So good afternoon. I'm Margaret Robinson, the Associate Director for the Office of Interdisciplinary Programs in the Office of the Vice Provost for Academic Affairs and Faculty Development. It is my honor to welcome you to our first inaugural Unity Appreciation Day. This is a virtual event to acknowledge and share appreciation for the dedicated service by our students and faculty and staff, contributing to the delivery and expansion of the interprofessional experience referred to as Unity Clinic and the Unity series during the 2020-2021 academic year. In a moment, Daniel Gibrelli, our Unity Clinic chair, will provide a bit of background and history about Unity Clinic. But first, I'll briefly share a short background on our office and make a few introductions. In 2016, the work of our volunteer interprofessional faculty was brought under our Chief Academic Officer, Vice Provost Valerie Williams, to assist in expanding interprofessional curricular programming to the entire campus. In 2017, under the guidance of the core faculty, we organized the Interprofessional Educators and Practitioners Association, or as we refer to it, the IEPA. The IEPA operate with 4 key committees: curriculum, faculty development, research, and our student faculty group, now referred to as the Interdisciplinary Student Council. These committees work together to design, develop, implement, and evaluate sustainable longitudinal IPE content to meet each program's accreditation requirements. The EPIC Clinic, which was an acronym for Empowering Patients Through Interprofessional Collaboration, began in 2012 and continued to provide quality team experiences to approximately 80 students a year. Unfortunately, the infrastructure did not support campus-wide expansion to include all students. All Professions Day, our campus-wide event intended to introduce early career learners to the IPE competencies, was added and continues to be a successful orientation activity. In 2017, our curriculum team, under the leadership of Dr. Denise Bender and Lin Goldston, began the mission of creating a 2-year longitudinal curriculum to provide IPE learning experiences to all learners. The intention is to create a menu of IPE content options where all students do not have to do everything, but all students can do something. This framework, coupled with our Wisdom Family Foundation seed grant projects and the curriculum alignment projects of our academic deans and directors as part of the academic strategic plan, has created a substantial structure of didactic, simulation, experiential, and reflective exercises. Our clinical enterprise continues to be a primary focus because it allows student teams the opportunity to not only meet accreditation requirements for hands-on learning, but to also provide a meaningful outreach to our community. With the support of Dr. Dale Bratzler, our curriculum team, research led by Dr. Vincent Dennis and Dr. Melissa Kraft, and many other key collaborators, the IPE clinical experience was mature enough to consider program expansion. And this is where we introduce you to Daniel Gibrelli in our story. As a first-year medical student, Daniel approached Dr. Bratzler with this big, hairy, audacious goal. Dr. Bratzler referred Daniel to the IEPA, where we were able to work with him, Carrie McLean in the Office of Diversity, Equity, and Inclusion, and Dr. Bob Salinas in the College of Medicine to all contribute to a major paradigm shift in the delivery of IPE content to now be student-led. I'll let Daniel share the details. But first, I'd like to pause and provide a bit of appreciation and recognition. Daniel is one of those students that we in higher education dream of encountering. He is self-motivated, idealistic, yet eager for mentorship and coaching, forward-thinking, collaborative, and undaunted by challenges, choosing to see them instead as opportunities for improvement. His impact will be felt for years to come, not only through Unity Clinic, but in our Unity series programming, where we are intentionally inclusive and practice participant-centeredness in all of our curricular programming. Most noteworthy will be the successful establishment of the Interdisciplinary Student Council, an academic unit under the Office of Interdisciplinary Programs, where students will have a specific opportunity to inform and participate in the planning of IPE curriculum with our IEPA curriculum committee. This legacy will ensure that our interprofessional training that will touch the lives of hundreds of new health professionals each year and countless patients and client lives in their professional service is intentionally unifying and focused on unity and health for all participants. Unity is not just a word or a catchy logo. Unity is a purpose and a legacy. Daniel was awarded the 2021 Interdisciplinary Student Leadership Award, previously at the OUHSC Campus Awards. This honor, while distinctive, pales to acknowledge his true impact on the university and the state of Oklahoma. My words cannot do you justice, Daniel. I thank you for your dedication and leadership to team collaboration, and I wish you well in your emergency medicine residency in Arizona. I now introduce Daniel Jabrelli, founder of the Unity Clinic and our current Unity Clinic chair.
Thank you, Margaret. As always, you're way too kind, and I'm grateful to have you and everybody who's on the team to bring this huge initiative to life. When we started on this journey 3 years ago, we did so with an abiding faith in our students and our ability to come together and shape the future of healthcare. So when we started this, we brought together students of all the different colleges and made sure that we approached our mission in consistency with the needs of our community and the needs of our students. Next slide, please. So we were able to pilot our work in the spring of 2019. And with that, we began the effort to incorporate all the 19 different professions on our campus. Next slide, please. So all the different professions listed here on our screen, we brought them together, identifying ways, how can we incorporate everything in a meaningful way? Next slide, please. Since then, we've been able to host 4 clinics a week, including 3 clinics at our local community clinic, the Good Shepherd, as well as our community outreach at the Cole Community Center. So with that, we were fortunate to be able to have our ribbon cutting ceremony to officially celebrate our efforts in the Cole Community Center, marking the first day that we're able to actually go into the community and live up to the value of a mobile clinic. Thus far, over 500 students have gone through the Unity Clinic experience, and we've seen over 371 underserved patients. We've been able to live up to the values of being diverse and incorporating all the different folks in our community. And through that, we've been able to bring together an LGBTQ simulation so that the entire healthcare workforce on our campus can serve that community in an effective way, really impacting the future of healthcare. We've been able to incorporate our efforts into multiple curriculum of our colleges, including College of Nursing, Pharmacy, Medicine, Social Work, Allied Health, and Public Health and College of Dentistry. And so there's so much that is happening, and we're so excited to be able to get our work into those colleges. We've been able to take our work and show our efforts in local, national, and international conferences. We've presented our work to the Oklahoma State Board of Pharmacy, advocating for our ability to dispense medications to underserved communities in our mobile outreach. We've received a $1.1 million HRSA grant, allowing us to take our efforts on the road to even a greater expand. And we did all of that in the midst of COVID. So through all of this, COVID has provided a new challenge, and our team stepped up and we created a telehealth system that not only allowed continuity of care for our patients, but allowed our team to be able to participate in a safe way interacting with patients. We've trained over 350 students to administer vaccines in the fight against the pandemic. We've been able to partner with OU Health to expand our effort, and we've done so by leveraging the entire community of our campus, bringing together folks from College of Dentistry, as an example, to be able to administer the vaccines, folks from the Graduate College, College of Allied Health, to help make sure that our vaccine clinics are being run in not only in a professional way, but in a way that's consistent with our community and their needs. And with that, we've worked with community partners to take the vaccine to them so that we can meet patients where they are and administer the vaccines there. And to date, we've vaccinated 50,000 patients in the state of Oklahoma. And so with that, if 3 years ago I had come to the team and said that is what we would accomplish, some may have said that our goals were set a little too high, that we should aim for something that's perhaps a bit more realistic. But that's what we did. And I'm incredibly grateful for the team that made this possible. It has been the privilege of a lifetime to be able to bring this legacy to our campus and be able to continue to see this grow. With that, today, it is not an overstatement to say that this is the best team ever. The best team that's been able to bring all of this together and have an impact this great in such a short period of time, being able to step up during a global pandemic to help our community and continue to educate the future of healthcare providers. So I'm very honored and privileged to be able to help host this event today to celebrate our team. With that, I would like to pass it to Dr. Williams to give our first set of awards for the day.
Thank you, Daniel. I appreciate it. I am Valerie Williams, and I'm probably the first person who actually had a title here as interdisciplinary programs, but I'm certainly not the first person to have worked on interdisciplinary education here at the Health Sciences Center over the last 3 decades. Our programming has included work through Oklahoma Lend, through the Center for Learning and Leadership, and through our faculty development efforts across the campus, as well as what's happened at our Clinical and Translational Resource Center. First people I met were Dr. Barbara Kahn and Dr. Terry Gallmeyer, who were the first 2 faculty who were working on interprofessional work as part of the College of Medicine through the Center for Child Abuse and Neglect. So all the foundational work that's been laid, and Daniel and all of your colleagues among the student leadership group, and Margaret and everyone on the team, you've done a fantastic job along with your faculty colleagues in actually building the program to what it is today, and I'm just really delighted to be joining you. The awards that I have the pleasure of presenting are those associated with our ability to provide meaningful and impactful interdisciplinary programmings in collaboration with communities, with patients and families and as team members. And it's my honor to recognize a few of those on the Unity Clinic team who have specifically contributed in this area. The Patient Community Advocacy Award will be given to Ms. Frida Freeman Cooper and to Dr. Bob Salinas. If I can take a moment, I'd like to introduce Frida Freeman Cooper to everyone. Frida is a social worker in the Department of Psychiatry who participated in Unity Clinic inaugural student team while she was still in the Masters of Social Work program at the Anne and Henry Zarrow School of Social Work. She continued her service to Unity Clinic past graduation and has been the primary liaison to our new community partners. Most noteworthy is Ms. Freeman Cooper's work with the Mental Health Association of Oklahoma and First Church of the Nazarene, and that led to the pilot mobile outreach project at Cole Community Center. Her leadership was instrumental to the establishment of this opportunity, and her focus on improving team communication and respecting patient values is a legacy that will endure for students in the future. So Frida, we thank you for your service and congratulations on receiving this award. And in my area, we cheer for people like this, so you all can show hands and cheer. Thank you, and congratulations, Frida. Next, we'd like to share our appreciation for the work of Dr. Bob Salinas. Dr. Salinas serves as the College of Medicine Assistant Dean for Diversity, Inclusion, and Community Engagement. In this role, he has been a collaborative partner on the Mobile Outreach Initiative. Through an invitation to participate in the True Oklahoma HRSA grant that's intended to expand primary care opportunities improving outcomes for tribal, rural, and medically underserved communities of Oklahoma, the Unity Clinic has been able to partner on the purchase and development of a new mobile outreach vehicle. This vehicle, while being multi-use in outreach to our communities, will allow Unity Clinic to transport their equipment for team-based care to community locations for clinical care to be provided with community partners at those locations. This project will improve access to care for Oklahoma's most vulnerable populations and expand our collaborative partnerships with health practitioners and state resources. Beyond this impressive project, Dr. Salinas also serves as a monthly medical attending at the Good Shepherd Clinic. So Dr. Salinas, I thank you for your service and collaboration, and applause for you as well. Thank you so much for everything that you're doing to advance interprofessional education and community service to patients and populations in Oklahoma. So now I will invite Daniel back to the mic to give tribute to someone who's devoted her career in service to our students, Margaret Robinson.
Thank you, Dr. Williams. It is such a special privilege to be able to recognize someone who's had such a great impact on me personally and students like me for such a long period of time. And so with that, we wanted to make sure to recognize Margaret. Now, we had to do this without Margaret's knowledge because she is the type of person who, if we were to tell her we were doing this, she is so unassuming and would not take credit for any of the work that she's done. And so we had to make sure to recognize her despite her being mad at me for doing this and giving her recognition. I don't think that I can do justice to all the work that Margaret has done. And so with that, I've asked some of our students to also speak on the work that Margaret has done. So Addison, if you could hop in and talk for a moment.
Yeah, for sure. Thank you so much, Daniel. So yesterday, Daniel called me and told me that we would be honoring Margaret today. And my first thought when he asked me to speak about having Margaret as my boss over the past 6 months was somewhat overwhelming to me. I'm not one that shies away from talking. A lot of you on this call know me, and I'm always able to chime in here or there. But today, I wanted to make sure that I hit all the high notes because this was different to me because the person that I was speaking about has become one of the most very important people in my life. So last night I sat down to write something out, and my goal was not to convey how an amazing of a boss Margaret is, but how truly amazing she is as a human being. And the best way that I know how to do that is to start from day one. So my first several times in the Unity Clinic, I saw this woman sitting in the Good Shepherd office. I had no idea who she was. I personally thought she may be a student because I had never been to Unity Clinic before. But the joke's on me because it turns out that she was actually the director of the program and would one day be my boss. So I remember each time I was coming to clinic, I thought, oh, I get to see Margaret tonight and I get to talk to her because all of my conversations with her were so impactful and just made me excited to be at clinic and to see the future of Unity Clinic. So in the short time span that you're with Margaret, you're able to see her heart and how much she loves what she does. And then you're around her more and more, and you can really tell that she loves what she does by how she treats everyone around her, her students, her colleagues, and her fellow staff members. Margaret is the epitome of servant and transformational leadership. She leads us every day in the correct direction by leading beside us and never in front of us unless it's necessary. And sometimes with this particular group, it is. Margaret, I just want to say that you're the glue that keeps us together, the shelter that we run to when we've maybe bitten off a little bit more than we can chew, and the voice of reason behind all of Daniel Tram and I's crazy ideas. Okay, mostly Daniel's. As well as any other student that comes to you. You are the epitome of a student advocate and a Unity Clinic champion. And some examples that I want to highlight of that pertaining to Margaret that display her servant leadership is when we were at Children's doing the vaccine pods. She would be there at 5:30 in the morning after working a 40-hour week with coffee in hand for not only herself, but for me and her other team members. She would show up on Sunday afternoon to help us unload vaccine supplies on her one day of the week, maybe off. And then most recently, even going to pick up the graduation cords when she's currently very sick to ensure that students have them. And I could list 100 of personal examples of how Margaret has impacted me with her servant leadership, as I'm sure all of us on the call could today. The last thing that I will say is, Margaret, you say all the time that all of the students and the faculty coming together is the reason for the success of the Unity Clinic. Well, I believe that's true to an extent, because we do have an amazing group of faculty and staff and students. I mean it when I say that we would not be here today without your leadership. The workplace culture and the learning environment that you have created is bar none. Your advocacy, your inclusivity, and your passion to make our IPE program the best in the nation is one of the main reasons we are where we are today. Thank you is not enough, but I would personally like to thank you for your willingness to show up, to lead by example, and to dive right into the trenches beside all of us. Your Facebook post, yes, your Facebook post, summarized perfectly who you are as a person and what your heart displays. I want to assure you that when someone mentions your name, they are surely to describe you by your kindness, your empathy, and your grace that you extend to all of us. Today, as we recognize you with the day's most prestigious award, I cannot think of anyone better suited. Thank you all for that you do, Margaret, and congratulations.
Thank you, Addison. And as I suddenly am impacted by a hit of allergies, of course, I'm going to pass it on to Trent for a moment to share her perspective as well.
I'll be honest, I do not know how to follow up after Addison's really touching message. Also kind of teared up a little bit over here. I know that's not allergies, Daniel. Don't even try and cover that up. No, I think that the effect that she has had clearly on Daniel, on Addison, and on myself as well is very apparent in the work that we've been able to do. None of this would have been possible without the leadership and the guidance of Margaret. Not only has she been our champion and our biggest supporter in all of our endeavors as students, she's also been our biggest voice of reason when we might get a little too ambitious sometimes. I'm looking at you, Daniel. Yeah, I'm just echoing everything that Addison and Daniel have already said. I haven't even known you for a full year yet, Margaret. We met just, I don't know, back in October maybe, and you have been my biggest role model already as one of the faculty members on campus. And I feel so lucky to be in your presence and to have your guidance through everything I do through my time here as a medical student. I'm so looking forward to what the next 2 years and beyond brings for our team. And again, feel so fortunate and so blessed to have you here today and in the future. Thank you so much, Margaret.
Thank you, Tram and Addison. Through the presentation today, a lot of the things that I say are based off of the experience that I've had, but for Margaret, I had to write this down because I knew it would be very challenging for me if I didn't. So to the best boss ever, the strongest woman I know, our biggest cheerleader and the pillar of IPE office, Margaret's tireless work, compassion is the embodiment of a true student advocate. Your candid and honest counsel has made me a better person, a better leader. And thank you for empowering us to try and helping us up when we fall. You've reinvigorated the passion of our students. You've earned the lifelong appreciation of a grateful team. And thank you for believing all the way through every hill and valley. And it's been said, but our team wouldn't be here without you. For all the challenges and all the tough lessons, for all the places that I've fallen short, what's kept me going every time has been you. You've lifted me up personally the whole way, and I hope that sometimes we picked you up too. Sorry for that, Dr. Williams. I'm going to pass it off to you for presenting the award. I appreciate it.
Sure. Gosh, there is absolutely nothing to be sorry about. Those heartfelt expression of regard and respect and love for Margaret is something that I think we all share, and it's just so lovely to hear you, Daniel, and Tram and Addison express your appreciation that way. I'm sure Margaret appreciates it well, and I would bet that she's always never without words, but I would suspect that right at this moment she probably is without words. I think that was just the best tribute ever. And I want to say that when Daniel invited me to give the Student Advocate and Unity Champion Award to Margaret, I was just so happy that she was being recognized in this way. And I think everyone who's participating in the Unity Appreciation today is feeling the same way. Margaret, it's a true pleasure to hear the regard that our IPE students have for you. And the tribute that Daniel and Addison and Tram offered was just so lovely and clearly from the heart. You are personally an emblem for Unity, defined through the way you work and the work that you do and the way you do it beside everyone who you engage with. And the students clearly appreciate your leadership, your being a role model for them. Your commitment to the students and their opportunities to learn and to lead has been central to who I've known you to be the entire time that I've known you, and probably for even longer than when I know you. So I knew you in your older days, in your previous days at one of our colleges, and when we were able to recruit you to this team to help us lead the interdisciplinary program's effort and expansion. You always speak to me about the joy that you find in working with our students, and clearly the students are feeling that joy that you have working with them as well. So I'll close by saying to the students on your behalf, Margaret, Margaret is a person who will always have your back, and she will always be looking out for your best interests at the forefront of the way she thinks about our students and what it is that you're capable of doing. As much as you regard her in the way you've spoken about her, she holds you in the same high regard. I am absolutely positive about that because of the way she talks about you all when you are not in the room. So, Margaret, I can assure you there's no higher praise that any of us can garner than to hear as educators from our students about something that they freely offer as regard. And so thank you for your dedication to student-led interprofessional education on our campus, and congratulations for being the inaugural recipient of the Student Advocate and Unity Champion Award. Congratulations, Margaret. And with that, I'm now happy to introduce the co-chairs of the Student Faculty Committee and our advisors to the Interdisciplinary Student Council, Lin Goldston and Dr. Ruby Sharif Sandel.
And Lin Goldston is actually caught in a meeting, and I will be doing her presentation. And if I had known about all of this, I would have made sure to, not have it right after when I'm still crying. I'm sick though. I'm not crying. It's allergies. So
Tears of happiness are always good tears. Never be embarrassed about shedding happiness tears. Okay.
Well, thank you, team. Such a great presentation there, and I really appreciate the heartfelt sentiments. And if I could talk today, it'd be wonderful. So I'll go back to the script so that I can stay on cue here. So I will be presenting for Lin Goldston, and I will be joined here shortly by Dr. Ruby Sharif Sandel to do a few award presentations, which should be the highlight of today's presentation. So without further ado, it is my privilege to introduce the inaugural Outstanding Service Award. This year's honoree is Addison Davis. This award is given in recognition of significant contribution to a major project resulting in expansion of IPE opportunities to greater numbers of students, faculty, and staff. The award was selected by the Unity Clinic Executive Team and the IEPA Executive Council. From her nomination, I'll read. Addison Davis has provided significant service to Unity Clinic deployment this year. The orientation, logistics, and debrief sessions have been dynamic throughout the year and often go unnoticed as vital to support of the learning and patient care experiences. Addison has been quick to identify and address issues that detract from Unity Clinic, and I suspect has managed much between clinics that goes unrecognized, and I know that to be true. She balances a servant attitude with the need to move forward to meet the objectives of the experience. Congratulations, Addison. I now introduce the co-chair, Dr. Ruby Sheriff-Sendell.
Thank you, Margaret, and congratulations. It is my honor to acknowledge my co-chair, Lin Goldston, the recipient of the IPE Innovation Award. This recognition is given to a student or faculty who initiates a novel, innovative, sustainable IPE project. The award was selected by the Unity Clinic Executive Team and the IEPA Executive Council. Lynn serves as the Executive Director of the Academic Affairs for College of Medicine, and she was a founding member of on the core faculty team that led to the creation of EPIC experience. As a student, she was instrumental to the establishment of HSC Campus IHI chapter, the healthcare chapter, and inclusion of students in the curriculum process related to quality improvement. As a past director of the CSETC, Lynn has been an unsurpassed campus partner for the creation and delivery of hands-on interprofessional practice. Most recently, she has led multiple multi-million-dollar grants and projects that have expanded interprofessional education and practice. This is from her nomination, I'll read. Lynn has been a constant innovator in the interprofessional education and practice at the OUHSC campus. Her leadership has been instrumental in the development of the fourth-year IPE selective pilot, the collaborations between the College of Medicine and others, and advisement of the Unity Clinic. Lynn, although you're not here, but we are honored to award you the inaugural IPE Innovator Award. This award will be henceforth be known as the Lin Goldston Unity Award for IPE Innovation. I now introduce, congratulations, of course, Lynn, and I now introduce Sean Abbott, an Interprofessional Student Council Chair.
Hello, everyone. My name is Sean Abbott, and I'm a fourth-year medical student, and I just matched in otolaryngology head and neck surgery here at OU. So if you see me around the hospital, feel free to stop me and say hi. So with that, it is my honor to announce the Student Leadership Award. This recognition is given to recognize significant contributions by Unity Clinic participants who have promoted student leadership and engagement of students in the clinical experience. The award was selected by the Unity Clinic Executive Team and the IEPA Executive Council. From the nomination, Anna Sahlstrom has worked diligently in her role as pharmacy chair for Unity Clinic in many impactful ways, including developing infrastructure for subsequent student leaders from our college, identifying important areas for input from our college, and advocating for and supporting pharmacy student involvement in Unity Clinic activities. Her input led to the assignment of additional second-year pharmacy students for observation at the Unity Clinic. The idea has been important to inform and identify students who may have had an interest in pursuing formal leadership roles in subsequent years. She has dedicated additional time at Unity Clinic this year along with the other leadership students and enthusiastically supported P2 and P3 students during their assignments. I have worked with Anna for many years, and she has always been a champion of interprofessional development and teamwork. She served as a Unity and Health panelist in 2019 and has served on the Mobile Pharmacy Committee and has served as the Unity Clinic Pharmacy Representative for the past year. Anna is a great, inspiring leader. Her great work regarding interprofessional development has had a great impact on our college and HSC community, and this is why I believe she is both deserving and worthy of receiving the IPE Student Leadership Award. Anna, congratulations on your award and thank you for your service. And with all of that, I will turn it over to Daniel for the next awards.
Thank you, Sean. Now that my allergies have subsided, I wanted to, before jumping into the next presentation or in the next award, I do want to mention that the work that we've done has been the culmination of a lot of folks that have made the clinic possible. I initially, when putting all this together, it was really just how do you recognize so many people in an effective way? And so these awards have been selected by our faculty and students in IEPA. That's one thing that I want to make sure to mention. And then also is we cannot do justice to all the folks who have helped make this happen. So thank you everybody for making our work possible. With that, one of the groups of folks that have made the Unity Clinic possible and as interprofessional as it is today is our College of Dentistry leadership team. And so it is my honor to announce the IP Excellence Award. This is awarded to students who demonstrate excellent interdisciplinary communication and collaboration skills. These honorees were recommended by the Unity Clinic Executive Team and the IEPA Executive Council. And so this award, it goes to our College of Dentistry leadership. That's Sierra Stapleton, Ellie Miller, and Emma Brito. I want to just say that if they were not part of the team, we would not have dentistry on our clinic. And not only did we, that picture was actually taken before COVID when they initially helped bring College of Dentistry into the Unity Clinic. And then beyond that, this year, fighting consistently so that we can have College of Dentistry in the Unity Clinic despite COVID in a safe and effective way. So congratulations to them. It is very well deserved. So really great job. With that, I want to recognize a group of folks that have been the champion for Unity Clinic, especially for the past year. First, I want to recognize the way that we've selected these our candidates and our awardees. So excuse me. So the four folks that we are recognizing today were recommended by our students. These are the people that have been with us every single day and helping us making sure that our clinic is successful. And that cannot be anybody. That is the embodiment of Dr. Vincent Dennis. Dr. Dennis has been with our team since the beginning of the Unity Clinic and has helped not only be at Unity Clinic every single session this semester, but in addition to that, making time to meet with students and mentoring them in order to be successful at the interprofessional and the student-led aspect of the Unity Clinic. It goes without saying that as much as our students have passion, we do need that guidance, and Dr. Dennis has been the embodiment of that, and we're very fortunate to have him on the team, and we're very grateful for his help with the Unity Clinic. So congratulations, Dr. Dennis. Next individual that we'd like to recognize is Dr. Koldoff from College of Nursing. Dr. Koldoff was the very first person that we worked with this year to bring Unity Clinic back after COVID. With Dr. Koldoff's help, we were able to incorporate the College of Nursing into Unity Clinic and integrate that collaboration. We've been able to bring through all of the students from College of Nursing in the BSN program because of her efforts, in addition to just showing up to clinic and overseeing our students. Her flexibility as we've grown and gone through a lot of changes has been incredibly helpful in making sure that we are able to continue to grow and be successful as a team. So Dr. Koldoff, thank you so much for all of your work. Very well deserved, and congratulations. Next, I'd like to recognize Professor Murphy. Professor Murphy has been a huge champion, not just of the Unity Clinic and our students, but our efforts with the vaccination clinics. Professor Murphy has gone above and beyond being present for our students, making sure that they have the proper supervision, but also incorporating the interdisciplinary spirit of the Unity Clinic into the vaccination efforts. With the help of Professor Murphy, we were able to create a centralized approach to responding to the vaccination efforts in our community and make sure that we're incorporating our efforts together as a campus instead of being siloed. And so if it wasn't for Professor Murphy, we would not be able to do that. And not only is our team better off because of Professor Murphy, our community and our entire campus is better off. So thank you so much, Professor Murphy, for your work. We're very fortunate to have you on our team, and congratulations. Last but not least, I'd like to recognize Dr. Skaggs. How do you describe Dr. Skaggs? She is the most positive, energetic, and amazing provider we've had the privilege to work with. The consistent feedback when our students find out Dr. Skaggs is our provider is just a look of excitement. Dr. Skaggs has been our champion in helping us promote our efforts in the community, specifically taking our work in integrating it into a telehealth model, as well as being able to take that implementation and go to our community outreach co-community center. Dr. Skaggs' ability to work with students in an effective way and being available so that we can continue to do this in a safe way for our patients and our team has allowed us to expand our efforts and really bring to fruition the long-term vision of the clinic, which is to be able to go out into this entire state of Oklahoma and serve the patients regardless of where they are, taking our care to them. So Dr. Skaggs, thank you for your time and dedication, and thank you for being our champion within the Unity Clinic. So congratulations as well. And with that, it is my honor to introduce Carrie McLean, who has been a partner with us from the beginning, allowing our team to grow and expand in the spirit of diversity. So Carrie.
And inclusion has a mission to enhance OU's commitment to diversity, equity, and inclusion. We recognize and respect the essential worth of each individual and value differences amongst groups. We commit to building a welcoming and supportive campus environment where each individual feels welcomed, valued, and supported for success. As a partner in the development of interprofessional activities, I have worked with the Unity Clinic team and IEPA to ensure their work is mindful of our campus's commitment. It has been a joy to be able to be in this space with you all, and it is my honor to announce the Unity Appreciation Award for Diversity and Inclusion. This award recognizes significant contributions by Unity Clinic participants dedicated to expanding diversity and inclusion throughout the interprofessional curriculum series referred to as Unity Series. This award was selected by the Unity Clinic executive team and approved by the IEPA Executive Council. This year's awardee is Riley Darby-McClure. Riley will leave a legacy of inclusion for years to come that will impact the citizens of Oklahoma and beyond. Early in their career, Riley approached the College of Medicine with an idea for a simulation focused on treatment of patients from the 2S LGBTQ+ community. They worked with faculty and staff in the creation of the curriculum, recruitment of community members to play the role of medical educators as simulated patients, and in the evaluation and related debrief discussions. The success of this project was quickly realized, and others on campus were eager to benefit as well. With Riley's leadership, an advisory board was put together to transform the College of Medicine activity into a community-informed, campus-wide activity. The project will be piloted this summer and offered monthly in the coming academic year. The intention is for all OUHSC students to have the opportunity to participate in this interdisciplinary learning opportunity, and therefore ensure the health providers of tomorrow are equipped for the conversations and treatment scenarios unique to this patient population. Riley, your advocacy and dedication are remarkable. The university owes you a great appreciation for sharing not only your vision, but also your time in transforming this from a great idea into a deliverable and sustainable project. Riley, we wish you well as you begin your residency in California and hope to see you again in the future. And now I'll hand it back to Margaret to close today's event.
Thank you so much, Carrie. That was wonderful. This will conclude today's program. We extend great appreciation to our many student, faculty, and staff collaborators who have made this past year a success. Folks like Pam Timmons at Good Shepherd Clinic and Averella Fleming at First Church. Aaron Bailey with OU Health, who was such a great ally, along with Kylie Fitzgerald in running the vaccine clinics. We owe you our success. In this year of COVID, when we didn't even know if we would be able to deliver clinical programming, we were able to expand and grow beyond our wildest dreams. And it's because of each of our partners that we are well on our way to becoming the best IPE program in the country. I thank you for ensuring that our graduates are leaving here with unique and distinctive skills in collaborative teaming. And I look forward to working with each of you to continue our mission in providing interprofessional education to all learners. Thank you for sharing your lunch hour with us today. I hope you have a great afternoon.